For over 62 years, from our family to yours, Bailey's Fine Jewelry can assist you with all your jewelry and giftware needs.
Wedding registries, anniversaries, and birthdays, think of Bailey's for every occasion. We're sure to have that special gift for that special someone. Nothing shows you care more than a Bailey box.
For jewelry repair to custom designs, our gemologists, master jewelers, appraisers, and watchmakers are sure to provide you with the best service possible. Quality and trust. That's the Bailey way.
Life's full of unforgettable moments. Spend a moment in your Pandora store and experience the new collections.
This is Tri-County Live, bringing you the best from Nash, Wilson, and Edgecombe counties. Now, let's join our hosts.
Good evening. Welcome to Tri-County Live. We have a special show for you tonight. I'm joined with Clint Williams tonight. Tanja Philbeck. Did I say it right?
You did.
And Michael Strickland.
Glad to be here.
Michael and Tanja are they are employees with Farm Bureau, North Carolina Farm Bureau in Nashville. Nashville office. And they were so kind to come and talk to us a little bit tonight about healthcare reform. But first of all, I want to talk about some other products that you have. Just kind of run the gamut with what you have.
You want to do it?
You can.
Okay. Well, North Carolina Farm Bureau Insurance, we offer a wide range of products, anywhere from auto insurance to homeowners insurance, life insurance. We offer some small commercial insurance. Pretty much just about anything you can think about that needs to be insured, we can help you out with it.
Long-term care.
Long-term care insurance, disability insurance.
Supplemental type products as well.
Supplement, that's right. Yeah. And obviously, the reason why we're here tonight is health insurance. So we do that. We're authorized agents through Blue Cross and Blue Shield, and that's who we sell through.
Now, y'all are a cooperative. Is that kind of how y'all are established? How are y'all based, I guess?
This Farm Bureau in general?
Farm Bureau, yeah.
Well, Farm Bureau, this Farm Bureau Federation.
Federation.
That owns the insurance company. Of course, the Federation was established years ago to help out the folks in rural North Carolina. And one of the big needs they needed was insurance. So that's how the Farm Bureau Insurance has come about. And that's kind of who they've primarily focused on serving is the rural people of North Carolina. Now, we've, of course, expanded over the years to help all residents of North Carolina with all their insurance needs.
And people with Farm Bureau are members.
Yes.
People that are insured with Farm Bureau
Yes.
are members.
And that's kind of what I was going with.
You
Okay,
pay
yeah.
$25 a year
Membership fee.
Membership
fee.
fee.
And that's
I have Farm Bureau, obviously.
Yes, you do have to be a member to be
Yeah,
a part
you
of
have
Farm
to be,
Bureau.
right.
And with the membership, you do get discounts.
Right.
So a lot of people don't realize that. So that was one thing that we needed to kind of address
It's
on that.
kind of a long list of them.
It is
Yeah.
a long list of membership benefits.
You get a membership card, so if you have the official card, and
Yeah.
great benefits. You can get $500 off a Chevrolet or GMC.
You did, most what
Hotels.
people
Hotels,
use,
lots of hotels.
Most people use their membership for eye care. You get discounts on eye visions and get discounts on the contact lenses and glasses.
So there's benefits to being a member.
There is
Yes,
definitely
yes.
If you utilize your membership, it will pay for itself.
And how much is membership?
$25 a year.
A year. So there you go. So now, getting back to what you kind of finished with a few minutes ago, y'all do cover healthcare.
Yes.
And you are your only product that you sell in the healthcare is Blue Cross Blue Shield of North Carolina.
That is the company.
And y'all are going through a fun week.
Yes.
So exciting.
Tell us what happened on October 1st, which was Monday. Tuesday.
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 Yep. October 1st was obviously open enrollment for the Affordable Care Act, healthcare reform. So that is, people could go in starting Tuesday and look at what's available to them as far as insurance goes. If they would qualify for a subsidy, it's going to help them pay for the insurance. Just look at overall what their options are. That all started Tuesday, and that's going to run from October 1st to the end of March. That's the open enrollment window. So that's what started. There's obviously
And
been some
unfortunately,
issues.
a lot of technical
Yeah.
difficulties for the website.
I think that's been widely known now.
It has been overloaded, and so for us, we're trying to tell most of our members to let's just wait for a little
Right.
while until we can get the lines to open back up. Because to try to get on there and to start applying for in the marketplace, because that's where
Right.
you've got to go, it's totally overloaded right now.
Right.
Yeah.
So the latter part, maybe middle of October, latter part of October, we can jump on board and really, and that way, that's kind of ironing some of those kinks out.
But people are panicking because they're saying, well, I've got to get on there now because I've got to be signed up by January 1.
No.
Right.
Well, the reason for the health reform, it's to address the issues that are in the healthcare system.
Right.
By increasing the access to the health insurance and improving the quality. The main purpose of the reform is to help millions of Americans who don't have health coverage. Also, it is to help the ones who have health conditions who have been refused by health insurance companies and are being charged huge prices. It's to make it more affordable. So that's what the purpose of it is.
Okay. But do you have to be signed up by January 1st?
No, you do not.
We've got a
Okay.
window. The window for the first year, they're giving you all the way through the end of March to get signed up. If you want a January 1 effective date to start having your coverage can start January 1st. So if you need a January 1st start date, then you need to have your application in and applied for December 15th.
Right.
That will give you your January 1st start date. But you have until the end of March to get enrolled without any penalties.
So we have a little bit of leeway.
Yes,
Have a little
yes.
bit
In the first year. Next year, they're going to kind of start following the same window for Medicare.
Right.
The same enrollment period that will be for the same for the healthcare
October
reform.
the 15th to December the 7th.
Right.
Okay.
Will be next year.
And if you don't sign it, if you don't have it, there's a $95 per person or 1%
Of your income.
of your income.
That's the
tax.
penalty
That's
for
the
the first
first
year.
year.
Yep.
First year, right.
Second year increases, third year increases.
Right.
Also, another important thing is several of my members have inclusive health. Inclusive health is no longer riding in North Carolina effective at the end of this year, which is December 31st. It is crucial for them to go ahead and come in and let's go ahead and get them taken care of prior to December the 15th so they can get that January 1st effective date.
So
Now, there are only going to be 2 carriers in North Carolina.
Correct, right now, yep.
on the
For
exchange.
the first year.
On
On
the
the exchange,
exchange,
you're
right.
right. Now, your first, to clarify, of course, the exchange is where people have to go to enroll.
People who
Okay.
don't currently have insurance or the underinsured
Or
or
won't-
those who are being affected by changes. in
Right, or
insurance.
just want to look at their options and possibly move into a different plan. That's where you ultimately will go, is the exchange. In the exchange, you have 2 companies, Blue Cross and Blue Shield of North Carolina, and then Coventry, which is Aetna purchased earlier this year. In this area, our area, which Nash County, Edgecombe County, Wilson County, pretty much all of eastern North Carolina, the only option is Blue Cross Blue Shield. Coventry mostly operates central part of the state, out maybe toward Greensboro, that
right.
area.
The western part.
Then it's only Blue Cross Blue
Yeah.
Shield for us.
Yeah,
For
so,
us,
so if you
yes.
go on the exchange to look at what plans are available to you, you're going to see Blue Cross plans. If you live in this area, that's what you're going to see is Blue Cross plans.
So just to kind of step back just a second, because you kind of covered this a little bit. The reason for the Affordable Care Act, the term affordable is what people kind of trip over. They call it Obamacare, things like that.
Right.
The affordable part is because there's 48 million Americans who are uninsured. So they being Congress, created this plan that says we're going to make it available to this 48 million Americans. And we're actually going to force it on them by a tax. Whether we agree with that or not, that's what the law says.
Right.
You have to carry it. But they also define what has to be carried. In other words, the type of insurance such as what the coverages are.
Yes.
So that's kind of what has set all this up, is the need was the uninsured.
That's right.
And the folks who are going to pay for it are the folks who are insured.
Pretty much.
And we'll get into some of the details on that, but I'm
Okay.
just kind of trying to define what was the purpose behind the Affordable Care Act,
Right.
why we're doing it, and what's the consequences of it. Now, we've talked about this confusion about when people have to sign up. Kind of talked a little about who, but I really would like to touch more on who is affected by this, because if you have independent insurance, how is that going to affect you? Are you grandfathered in? Are you not grandfathered in? What plans are sunsetting at the end of this year? There's confusion.
Right.
If I have independent, what do I do? If I'm not insured, what do I do? If I lost my job, what do I do?
Right.
Right.
Go ahead.
First of all, the ones that are grandfathered in, such as myself, I would say, let's, what we need to do. We don't have to jump in on all of it. We can abide our time, and we can wait and see once everything gets ironed out a little bit.
Okay.
So you're grandfathered in. You do not have to make any changes.
Right.
You do not have to conform to the new health reform. You do not have to do any of that. The ones that are non-grandfathered in are the ones, particularly with Blue Cross Blue Shield, that have made changes after March of 2010. So if anybody has made changes after 2010, they are non-grandfathered, and they are
Subject.
subject to take
Right.
the Obama or the health reform. So with that, I've lost my train of thought.
Well, basically,
Who needs to be covered?
It needs to be covered. Okay. It's based on your income, obviously. So the first step is to basically, if you know your income, and you can talk with your employer. There's an employer form that you take to your employer off the healthcare.gov website, and the employer would help you fill that out. And it's based on your modified adjusted gross income. Okay. So there's a poverty level from 100% to 400%. If you are within that, you will be qualified what they call for a subsidy, or also interchanged with the tax credit.
So
Okay, let's
if-
talk about,
Yeah.
let's talk
Yeah.
about the subsidy a little bit.
Okay.
Because everybody
Let
is,
me-
okay, go ahead.
let me clarify that
Okay.
just a little bit.
Yeah.
Is you will qualify for a subsidy if you fall within that range, of the financial range there. If you do not have access to a plan through your employer or a spouse's employer. Anybody on plan at work, anybody that has access to a spouse's plan through their work will not qualify for a
So
subsidy.
if I have access to it but don't take advantage of it, just because I have access to it, I'm disqualified.
Correct. That's right. You can still go through the exchange. You can buy a new plan
But you
through the
don't get a
exchange.
subsidy.
You will not get a
You will not
subsidy.
get a subsidy.
So that may be something to
Independent
look at, is look at the price. What's it going to cost me through the exchange to get a plan there? And then what's it going to cost me to get added on to a plan at work or a spouse's plan?
Right.
And then compare the cost there, what's going to work best for you there. But, yeah.
A lot of people are concerned, Michael and Tanja. They're telling me that one of our callers called in this week and was very concerned, saying, I can't afford to pay this every month until I get my subsidy back at the end of the year as a tax credit.
Right.
So is there another
Option.
alternative other than that?
Yes.
Yes.
You can take the advanced premium credit up front.
Okay.
You do not have to wait to the end of the year to get that credit. So
Okay.
there's two options to do that. You can take the advanced premium credit at the time you apply,
Which deducts it from your premium.
which it deducts
Right.
it from your premium. So you go
Okay.
ahead and take that credit.
So that's good to know. I mean,
That is
because-
good to
yeah,
know.
because there's
Now-
confusion out
People
there.
Right.
don't
So-
know that.
Right.
So the premium, I mean, if you get the premium that you're going to be billed for whichever plan you choose through the exchange, whatever subsidy you qualify for, they can go ahead and deduct that from your premium, because the premium is the premium. Okay, the difference is the government's going to be paying part of it. Okay,
Right.
the premium doesn't change, but the subsidy will be deducted from that, and they will just bill you the difference.
And here's another thing: is if once you file your taxes at the end of the year, it's going to be based on was your modified adjusted income this much or this much? Was your tax credit this much or this much? If
So
it's
there's gonna be
higher
an
or lower.
adjustment.
So there's
Yeah.
going to be some adjustments.
That's
so
how
you
they're going
need
to
be
track it.
careful.
That's how they're going to follow it up. So
That's how they're going to follow up, is with the tax records in the tax. Once you file your income tax, then they're going to follow up and see, okay, well, we allowed too much for you, so we're going to.
You owe us some back.
We're going to get some back. That's right.
And then
so we
you
have
pay
to be
too much.
careful.
Right.
We might give you some back, but we're not sure about that yet.
There you go.
So,
Now, I want to go back to the grandfather clause. The ones that are grandfathered in also had this question. I'm trying to get my viewers' questions answered here. They're concerned that they're not going to get a subsidy because they're grandfathered in.
Right.
and they are correct.
No subsidy
They will not be eligible for a subsidy.
because it's lower anyway.
Not necessarily. It's just different plans. It's different. It's different coverages.
Okay.
And they're not. It's just they're grandfathered, and the premiums could be lower, but then there again, their premiums could be higher. So it just depends. They have to. Every person is. It's not
Right.
a cookie cutter.
So if you enrolled, 5 years ago and got a plan that's a grandfather plan now, let's say you were in perfect health, then you got a rate, you were underwritten with health questions, and that determined what rate you received and if you were approved or not. So if you were in perfect health, you got the best rate available. Well, now you're looking at the option of, should I change my plan and go into the exchange? Maybe they're offering some coverages, additional coverages that I don't have on my plan now that I want to look at. Well, the difference being that the premium between the two is the rates for the exchange are overall much higher than what they are in the old grandfather plans, because you've got two different pools of insurance. You have the people that have been underwritten, and that's going to be the best rates. And now you have people in the exchange who no one can be turned down. So anybody with illnesses and everything have to be covered. So obviously bringing in all of those people are going to increase cost. And so the rates have increased
And plus,
under that.
too, the insurance company has got to adjust as well in their premiums. So, it's going to be a little bit higher. They're getting a tax credit there, but it's all kind of fun.
Yeah.
Well, the men are telling me they have to pay for pregnancy care.
Yes.
That's some of my
Yes.
male
That is one
viewers.
of the essential benefits.
Yes.
Well, let's get into that after our break, because there's a lot we need to talk about.
Wow, we could discuss this all night, I'm sure.
But there's a lot to talk about in terms of some of the cost effects. We're tiptoeing around that a little
Right,
bit. There are
right,
some
right.
hard numbers we can kind of talk about. And you've provided some numbers on our local area and how it's going to impact
Yes.
those who may be uninsured. So we'll talk about that when we come back from break.
All right.
For over 62 years, from our family to yours, Bailey's Fine Jewelry can assist you with all your jewelry and giftware needs.
Wedding registries, anniversaries, and birthdays, think of Bailey's for every occasion. We're sure to have that special gift for that special someone. Nothing shows you care more than a Bailey box.
For jewelry repair to custom designs, our gemologists, master jewelers, appraisers, and watchmakers are sure to provide you with the best service possible. Quality and trust. That's the Bailey way.
Life's full of unforgettable moments. Spend a moment in your Pandora store and experience the new collections.
Imtac Precision Arms, open Tuesday through Saturday. Full service gun repair and restorations from a professional gunsmith. Custom-made firearms and ammunition, all manufactured in our state-of-the-art facility. A large inventory of guns and ammunition for all your needs. We offer year-round concealed carry classes, and you can hone your skills at our indoor shooting range. If you're going to do it from distance with Imtac Precision Arms.
Okay, welcome back to Tri-County Live. In case you just tuned in, we have Tanja Philbeck and Michael Strickland from North Carolina Farm Bureau in Nashville. We thank them for coming tonight to give us a little bit of information on the Affordable Care Act. Listen up, and I think we're going to have them back.
We were laughing during the break, so that's why we're all smiling.
We're talking about men getting pregnant, so wake up out there. No. Tanya, is it true that men are going to have maternity coverage?
Well, it is part of the essential benefits that is going to be required in the Affordable Care Act.
Right.
So there are going to be, it's what they call the metallic levels. The metallic levels start with bronze, silver, gold, and platinum. So whenever they're in the marketplace and they're looking and they're comparing prices and they're comparing plans, that is what they're going to see. They're going to see the metallic levels.
So do we have to look up the price of bronze on, as a metal? Is that what the pricing is?
That's right. And within
platinum's going to be your highest.
Right.
The platinum, of course, is the most. The best of the best.
Well,
and
last
then it's
I
going
looked,
to go down.
gold was exchanged at about $1,300 an ounce. So,
Well, it is the government that come up with this. But yes, the platinum is the most, and it's the best of the best. But then it's going to go down to more affordable. And then within the metallic levels, there's going to be different deductibles. So you've got a plan within a plan. So you get to choose and pick and see what fits your budget.
Right.
So, there is going to hopefully be something for everyone. And then, of course, there's what they call the catastrophic plan. But that's going to be for mainly people under 30. So that's an age limit thing. But inside all of those plans is what they call the essential benefits.
or as I call them, the must carries.
The must carries, yes, the must carries, and it is going to be the the ambulatory services, the emergency services, preventive services, as well as the wellness exams and chronic disease management, prescription drugs, as well as maternity and the newborn. So everybody will have maternity coverage. So that's what
we're clarifying this.
We are clarifying
Men
that.
can have babies,
and you can be double covered. You and your wife are both have maternity coverage.
But
now the frustration on that is I'm paying for something I'll never use.
Right.
But that's part of the subsidy of balancing this out across the board.
Leveling
the playing field.
Right.
Exactly.
Hopefully.
And so 22-year-old boys out there are going to be carrying maternity coverage.
Yeah. That doesn't mean that. Never mind.
We'll leave that one alone.
But the most important is the pediatric care. With the pediatric care in the essential benefits, it does include dental and vision for the children.
Just the children.
Just the children, but that is
so they can see and smell pretty.
18. Okay.
So.
And that's part of the essential stuff, and that is part of what was missing in national healthcare scene in terms of affordable care, was covering children. And then providing essential healthcare coverages for the uninsured.
Right, and there's such an issue right now too with mental health and substance abuse benefit, including the behavioral health treatments.
Those are all included.
That is included too. So that is something that was always limited, very limited on health care. And now it's something that is definitely covered and people can get help for.
And then the one other big benefit is going to be for existing conditions. People before who could not get coverage are now going to be able to get coverage.
Yeah, and that's where, where I had said in the beginning, it's just then nobody can be turned down anymore. They can't be rated up. They can't be refused coverage because they have a health condition. And that is one of the benefits that Michael is going to get into.
One of the advantages.
One of the great advantages.
We'll go ahead into the advantages if you'd like to, Michael.
And just to share a quick story about that, yesterday when all this started, I did speak with one of my customers who was a breast cancer survivor. She has some other pre-existing conditions that have kept her from getting insurance before. And now she'll be able to get insurance. She can't even be rated for any of her conditions at all.
Right.
So she's going to be getting a standard rate where she couldn't even get insurance before. She's also will be qualifying for about a $300 subsidy. So that's going to help offset her premiums. So really, her out-of-pocket cost for a really good plan is going to be about $150 a month instead of $450, $500.
Right.
So she went from not having insurance to having insurance and it being affordable to her. So that's one of the success stories that this whole
the purpose
reform is directly for. But yes,
And the 20 and 30-year-olds, you're helping to pay for people like that.
it's going to take the younger healthy folks to offset the older
Absolutely.
and sick folks, and that's just how they've designed it to work.
Right, that's
So
how
we're-
it's designed.
What Sandra's trying to do is we're putting a Band-Aid on one sore and poking out of the other one.
Yeah, yeah. I mean, I want people to all understand, what.
And to be fair, y'all with North Carolina Farm Bureau, y'all are representing Blue Cross, so
Yes.
you're not here to put it down. You're not here to prop it up. This is what you've been delivered.
Well,
We're going
these
to
are the
call it like it
facts.
is.
These are the facts.
This is the facts.
Right.
It is what it is. Healthcare reform,
It's here.
Obamacare,
It's
whatever
here.
you
What
want
are
to
you
call it,
gonna
it's
do?
real.
Whatever your opinions
It's
on it is,
here.
this is what you've got to work with.
And you got to.
And you need to
it's gonna make
educate
you do
yourself
something.
on it.
Right.
You really do. And the disadvantages.
Well, let me hit some of the benefits.
Okay,
real quick.
go ahead.
We mentioned they can't be turned down.
Right.
Females can't be charged a higher rate like they were before. Preventative services are covered at 100%, so you can go get your checkup, no copay, no deductible. Maternity coverage is included for everyone, which can be a pro and a con, but it is included. Where before it was an option that you had to choose, and it was
It was
expensive
very
option.
expensive.
There's other increased benefits in the health plans. Children can stay on their parents' plans to age 26, so that's helped out a lot of people coming out of college, having a problem finding a job. They're able to stay on to age 26. And of course, there's subsidies available to help offset the cost for some people. Now, going into the disadvantages, not everyone will qualify for a subsidy. Like I said, it's based off of income, and it's going to be based off if you receive insurance through an employer or have access to a spouse's plan.
And the subsidies are a sliding scale. So depending on how
Yes.
much you earn, you could get, if you fall under $25,000 a year, you're going to get more. If you could make, I think it's up to as a family, up to $78,000 is the limit for
Yeah,
married.
family of four. If you got a family of four, it's up to $94,000.
$94,000. Yeah.
$94,000.
Yeah.
Yep.
So I mean, there's room in there for folks in the middle class to get
Yes.
some subsidies, but they may not be as great as those who are on the
The
lower end of poverty.
Right. Another disadvantage is we've got a lack of insurance companies offering coverage in North Carolina. Like we mentioned it before, only 2 companies in the state, 1 company in our area, which
Right.
of course Blue Cross Blue Shield. It's a disadvantage because the more competition you have, insurance is all about spreading risk. And if you don't have the companies to spread the risk, you have one company taking on majority of the risk, it doesn't help rates. And that's why we've got the second highest rates in the country.
Well, and just kind of go back to defining insurance. Insurance, as it was originally intended, was many pay in, few take out.
Right.
Because you're hedging a bet.
Right.
You're putting in, hopefully, a small percentage are using it, while the majority are paying in. Someday you may need it,
Right.
but today you do. That's kind of how it's supposed to be.
right.
What's happened with healthcare is more people are taking out than have been putting in.
Right.
And this, whether we like it or not, is the balancing of the books to take care of whether it's Medicare, welfare, those other issues that have been helping the poverty end. But again, the 48 million uninsured, this is putting them on the books.
Right.
Right.
Exactly. A couple other disadvantages, like we mentioned before, there's some repetitive coverages. You may have a maternity coverage, your wife may have maternity coverage. You only need one person to have maternity coverage, but everybody has to have it. So some repetitive coverages there. There's additional taxes and fees that are built in with the healthcare reform that are being charged to the insurance companies. That's not helping with the cost of rates.
Right.
That's just part
Getting
of the deal.
passed on.
That's getting passed on to the customer, unfortunately. And overall, insurance premiums have increased. I mean, because we're talking about the taxes and fees that are being charged, which are high taxes and fees. You're looking at everyone being insured.
Right, the risk for
you-
them,
yeah, you've
for
got
the company.
people coming in may have cancer, may have diabetes, anything that's going to be taking a lot of medication and
So you're
treatment.
taking on more
Or
expense.
problems.
They're coming in, you're knowing you're paying that out of the pocket right up front, where before people were getting underwritten.
Right.
So that's obviously going to increase rates tremendously. But hopefully that's where we say the subsidies will come in and help a lot of people with it.
Well, and speaking of rates, no one can be rated up except tobacco
Tobacco
use.
usage.
So
25%.
25%
tobacco usage.
of tobacco use. So if you
Okay.
smoke, you're going to have a rate increase.
Wow.
Yeah.
Okay.
And then I think the last disadvantage that I want to mention, of course, are the penalties. We mentioned it earlier. There are insurance is being forced on you. You've got to choose a plan, and if you don't, you can choose to take the penalty. The first year is $95 or 1%, whichever is higher. The second year, what was it, goes to
Yeah, let's talk about
Goes to
it.
Yeah.
2%.
2%
I'm not sure.
or I would get
2%
it.
or it's $325.
Per person in the household.
That's right. And then 2016 is $695 per person, or 2.5%.
Whichever's highest.
That's
Let's
right, whichever's
clarify,
highest.
Whichever's
Yeah,
highest.
whichever's highest.
That's right.
You're
So
going to
if
be
you-
penalized.
Knowingly decline to carry health insurance, you are going to pay a penalty for it.
Absolutely, yep.
Yep.
Yep. Now, kind of the word under the table is the first year they're going to have a hard time enforcing that, and they're going to be kind of lenient on it. It's what behind the scenes they're saying.
But we don't know yet.
We don't rely on that, but that's what IRS has kind of mentioned, is they're probably going to take it a little easy on folks the
And
first year.
this, and that's leads
don't
us
rely
to
on that.
The next thing.
Yep.
This is going to be managed by the Internal Revenue Service.
Right.
It's going to be
Absolutely.
managed absolutely through the government. It's going
Yeah.
to be,
Now, who's everybody's favorite arm of the government?
and the thing is, we're talking about, getting those subsidies and qualifying, but there are, there's still, Medicare is, Medicaid is still intact.
Right.
But in North Carolina, they didn't expand it up to the poverty level.
Right. So there's a gap there.
There is a gap there.
So some folks that are going to make a little too much money from Medicaid and not quite enough money to actually qualify for a subsidy, they're kind of stuck in the middle. They're kind of left out,
Yeah.
and that's unfortunate, but that's how it has worked out. So there's a gap there in between, and of course, if you are beyond the 400% poverty level, you're left out as well. You're not getting a subsidy either.
Right. And if you don't file taxes, you don't get a subsidy either. So.
Right.
Now, you brought some numbers on the Tri-County area and who,
Yes.
who's impacted by this. So let's share this, because this is a local angle for us.
Yeah, so the Tri-County area, of course, we're talking about Nash, Edgecombe, and Wilson County. Blue Cross has estimated that there are about 31,000 people in the Tri-County area that currently do not have any insurance that will qualify for some form of a subsidy. So if you fall into that category, you don't have insurance, you're living in the area, you need to check into it, because it's a good chance you may qualify for some form of subsidy to help you out with it. So basically, Nash County, they're estimating about 14,000 people. That's the highest number.
That's almost half of that 31. So
Yeah, Edgecombe 7,000, and then Wilson County at 10,000.
now, considering a per capita type thing, that's not bad. I mean,
Right.
Nash County sounds higher than it maybe should be, but in Wilson
Right.
and Edgecombe, sounds like the majority of the residents have coverage of some sort.
Yeah.
So,
But of course, obviously, Nash County is probably the largest county out of the two.
right.
So as far as North Carolina number, about 869,000 people are estimated to qualify for some form of tax subsidy. So
I'm biting my tongue. I want to say something, but I'm not going to. You will.
But let's see. Also, they're estimating about 48% of the people that currently pay their own health insurance. You go through a private insurance company, you don't get insurance at work, you purchase your own insurance plan now. About 48% of those people will qualify for some form of subsidy. So right around half the people that currently
That's a
pay.
good number, again, to
Yeah.
talk about. If you are purchasing independent insurance,
Right.
or if you're getting it through, you're self-employed and you have a self-employed policy or something like that, 48% of those will possibly qualify for a subsidy of some
Right.
sort. And again, it may not be full amount,
Right.
but some sort of offset.
Something to help them out, yeah.
So there are opportunities to help folks who are worried about these costs out there.
Yeah.
Now we're getting into the good stuff. I'm looking at statistics. This came out last week from the CBO, and we talked about this during the meeting today at lunch. We were at a
Right.
lunch meeting today. Women in North Carolina, and I have the national statistics, but women in North Carolina, on average, based on the middle of the road, when they did the comparison. So if you got the, I guess in this case,
Silver
the silver
plan.
plan,
Yeah.
Silver plan.
got the silver plan. In North Carolina, women will pay on average 151% more for their health insurance if they're on the Medicare, on the exchange.
Right, than what they're paying
Specifically
now.
on the exchange.
That's right.
Than what they have now, not if their employer covers them or anything like that. That's a whole different can of worms.
That's right, they're completely separate.
And men will, again, in North Carolina, on the exchange and the silver plan, are looking at it. So you got the same chart.
Yeah.
267% increase.
Right.
And you have an anecdote that you can apply.
I can
to
vouch
this.
for it. I've already gotten my rate increase from Blue Cross, 282% increase for me, starting in 2014. So I've got to make some decisions. Unfortunately, I'm not going to qualify for a subsidy. My wife has coverage at work. I'm eligible to go on her plan. So that's probably the route I'll be looking at. I think it'll probably be a little bit cheaper that way, and actually it'll be a little bit better coverage. But not everybody's going to have that option to go on an employer plan. But hopefully a lot of people will get a subsidy to help with that increase. But of course, I am on the younger, male, healthy end. That's the folks that are going to be seeing the highest increase because we've got to offset
Right.
the older and
Just
sicker
what we-
folks.
And
So-
again, the CBO has clarified, young men are paying the highest
Yeah.
burden because they're essentially offsetting the cost for the 60-plus who are pulling out of the money now. Again, the insurance game. Some folks are putting in and some folks are taking out.
Right.
The young folks putting in now are basically making funds available to the other users now. So,
and looking at the chart we've looked at, North Carolina's got the second highest rates.
right.
You know, and again, that's primarily due to
In the nation,
No
In the nation.
competition.
Yeah, lack of competition. And, you know, we don't know exactly why more companies didn't come into North Carolina to participate. These companies are still participating
Yeah,
throughout the
they
country.
haven't gone anywhere.
They're
They're
picking
still
and
here.
they
the United
picked and
Healthcares,
choose.
the Cignas, all that
They
stuff,
pick
they're
and
out
choose
there.
which states
Yeah.
they want to
And
operate
they're
in.
still
Other
in North
states.
Carolina,
Yeah.
but they're still here, but they're not a part
Of
of
the
the
exchange.
exchange.
So you can go through them
Right.
and still get a health insurance plan, but you're not going. It's not going to be a qualified plan where you can get through the exchange where you can get a subsidy.
Right.
Yeah.
Yeah.
And there's only a few major health companies that sell individual coverage.
Yeah, Blue Cross is
Blue Cross is
really got the
is
marketplace.
giant.
They've been
Right.
here for years, so I mean,
yeah.
they've
They're
got
the
it.
giant.
So
They own the market.
they do now.
We got to take a break.
Oh, is it already timing yet? Good gracious.
We'll be right back on Tri-County Live right after this.
For over 62 years, from our family to yours, Bailey's Fine Jewelry can assist you with all your jewelry and giftware needs.
Wedding registries, anniversaries, and birthdays, think of Bailey's for every occasion. We're sure to have that special gift for that special someone. Nothing shows you care more than a Bailey box.
For jewelry repair to custom designs, our gemologists, master jewelers, appraisers, and watchmakers are sure to provide you with the best service possible. Quality and trust. That's the Bailey way.
Life's full of unforgettable moments. Spend a moment in your Pandora store and experience the new collections.
Imtac Precision Arms, open Tuesday through Saturday. Full service gun repair and restoration from a professional gunsmith. Custom made firearms and ammunition, all manufactured in our state-of-the-art facility. A large inventory of guns and ammunition for all your needs. We offer year-round concealed carry classes, and you can hone your skills at our indoor shooting range. If you're gonna do it from distance with Imtac Precision Arms.
Okay, welcome back to Tri-County Live. Again, we have Tanja Fieldbeck and Michael Strickland with North Carolina Farm Bureau in Nashville, along with me and Clint. I'm Sandra, this is Clint, and we've had a good time tonight getting informed about the Affordable Care Act.
This could be a 2-hour show easily.
Oh,
Yeah,
we're
really.
not. And you know, I do want to solicit, if you want to email questions to me or call the morning show and let us know what your questions are, then we will be happy. You can call me in the morning. I'm on the show in the morning.
Or
We'll be
you
happy
can call
to.
Michael Strickland and
And
Tanja
Tanja.
Absolutely.
at the
North
Farm
Carolina
Bureau.
Farm Bureau, absolutely. But
glad
I will
to
get
help
the
anybody.
questions to them. If anybody wants to go through us, we'll get the questions to them or call their office. What's your number?
252-459-3181.
Okay, give them
Easy
a call. They'll help you out. They really will. Again, I want to look after my Medicare viewers. Tell us a little bit about how they will be affected.
They're not going to be affected. There's no changes that need to be made. They're perfectly fine where they are.
Now let's repeat that,
Okay.
because if you're on Medicare,
Don't stress about it.
Do not stress
Okay.
about it. This does not affect the Medicare.
Okay.
It doesn't.
now who's on Medicare? Let's-
65 plus, or some. Well, the ones that are on disability now, you know, if they've got Medicare Part A and Part B, it does not affect them as well.
Okay.
So anyone that has Part A and Part B on Medicare, it is not affected. They are not
right.
affected.
Okay.
And if they say they're getting ready to go into, they're coming out of the, they're getting ready to turn 65. They do not use the marketplace to buy supplements. So that is
Okay.
another thing they need to contact. They need to go through the private sector.
Okay.
They do not use the marketplace.
Right.
So there is going to be kind of a growing pains period for some of our older Americans who are not quite 65 yet in terms of figuring out where they go.
That's right.
Right.
So, all right. So now we need to talk a little bit about how do you get it?
Yeah. How do you
You know,
enroll?
How do you enroll?
We've been hearing,
That's what everybody wants to know. What do I do?
Be patient first and foremost. Let's
Yeah.
just be patient.
Yeah.
But
Well, everybody's hearing about phone calls and the website. you
Yes.
know, and talk shows and other news shows, showing photos of websites,
Right.
you can't access this.
Right.
Online and phone, are those, and the national 800 phone numbers, are those the only two ways to get, on the exchange or find out what information is available?
Not at all. There's several options for people out there. Obviously, those are the ones that they're pushing. And healthcare.gov, that is the official site. That is the federal exchange site. That's where residents of North Carolina go to enroll. Now, you can choose to go there and enroll yourself. Try to log in and figure it out yourself. It's not the easiest process to figure out, but that is an option. Of course, you can call the 1-800 number as well. What we're kind of promoting and what we think is the best option is you need to contact somebody to help you out. There's people in the community that are certified to help you with this. They've been trained to do it. And then on top of that, there are licensed insurance agents that have been trained to help you. So you're
North Carolina Farm Bureau?
North Carolina Farm Bureau. Go talk to your Farm Bureau agent.
yeah.
Every one of them sells Blue Cross Blue Shield.
And they all had to be certified in the health market.
Right.
So we're all certified, we've all been trained, and we've put in some hours to get trained.
Right.
So definitely.
It's
So
just-
if you're a Farm Bureau member, and even if you don't have insurance with Farm Bureau, but you're a member
No.
of Farm Bureau, you have
They all sell it.
questions.
Well,
Does
you
it cost
need-
anything?
Let me say
It's-
this, you do not have to be a member to have our health insurance.
That's right. Because it's a
okay.
separate company, Blue
It's
Cross
a
Blue
separate
Shield.
company, so
Right.
you do not have to be a member, so you still can go through Farm Bureau.
wow.
So that's
Yeah.
free.
Yeah.
And does it cost anything? Does it cost more?
It does not cost you any more to go through an agent than it does for you to go online or call the 1-800 number.
It's the
So
same
you
price.
might as well save yourself a headache, find you an agent, and let him do the work for
Let
you.
him take the headaches
Oh,
on.
you better believe it.
No, she said him.
She did. But, the rate is the rate. It doesn't matter who helps you. So, we're all here ready to help. We've been preparing for this for a couple years now, especially as we've gotten closer to it. So we're eager to help people with this. So find an agent. There's Blue Cross. Like I said, Blue Cross Blue Shield is your main option. It's the only option in our area. There's Blue Cross Blue Shield agents, independent agents throughout the Tri-County area. And like I said, all Farm Bureau agents are Blue Cross Blue Shield agents. There's a Farm Bureau office in every county. So there's people there to help you.
And just to clarify, if you're on independent coverage now, you haven't been contacted yet because there's a lot of things going on, but you're nervous. You don't know what you're supposed to do.
Right.
Your premium, your contract isn't renewing till March maybe. You don't know
Okay.
what's going on. Contact your agent.
Just see what your options are.
Yeah.
Contact an agent just to find out what your options are. Don't just assume I can't afford this or I've heard this about this. Find out for yourself. Sit down with somebody because it's going to be, each individual is going to be different.
Right.
You know.
And based
And we're
on what
going
we
to take
talked,
them to the marketplace. And when we take you into the marketplace and we plug in your information and your personal information, we can find out if you qualify for a tax subsidy. So it's definitely beneficial for us to, for us to take you through the marketplace.
Right.
If you're not unsure, if you just don't know if you qualify,
now if you have independent insurance, do you have to go to the marketplace or can you continue to have independent coverage?
you don't have to go through the marketplace, but you won't get a subsidy either.
Right.
So you can keep, you do not have, you can still continue to go through the private sector.
Right.
Now, again, to clarify this, this is kind of leading into our next discussion. What's covered is dictated. Going back to the essentials of what you said before, so some people may have plans now that are going away as of January 1st.
Right. The plans are changing. They have to qualify under the healthcare law.
Right.
They have to have those essential benefits in there. So all plans are changing.
And so therefore premiums may be changing in most cases.
To
Now
keep
is
up
the
with that.
time to talk to your agent.
Right.
Right.
That's what we're saying.
Absolutely.
There's a lot of confusion on this. Talk to your agent.
That's right.
Well,
if you don't have an
as
agent,
Tanya
find an
said-
agent. Call us.
Right, as they said, Michael and Tanja, they're trained, and they said they've been training for 2 years. Well, evidently they've been training longer than the government because the system's all messed up.
They've been making it up
Anyway.
as they've gone.
It's been an emotional roller coaster. I just want to mash the stop button and get off for it.
Now, if you are confused and you're not sure about what's out there, there's also some erroneous information out there, maybe people who are preying on the uninformed.
People, watch out for scams. There's always people trying to take advantage of someone, especially with new opportunities like this presents a great opportunity for a great scam. Make sure the people you're talking with, the people you're sharing your personal information with are trusted people. Licensed, it would be great. That's what we would recommend.
They have to be certified to be.
You have to be certified, but you don't have to be licensed, but I would still recommend a licensed insurance agent because they have to uphold certain ethics, and that's what I would be looking for. But be careful of scams. Anyone calling you over the phone saying they're here to enroll you in your free insurance, don't listen to it. That's a lot of those things that will be going on like that, so just be cautious.
Well, that's why we say stick to your personal agent. I mean, stick to somebody you know.
So, and if
Go
you
to
don't know
your
somebody,
personal agent.
ask, get a referral.
Get a
Yeah,
referral.
if you don't know them.
There's lots of
you know.
people out there that
And
would
if
be
you're,
glad to refer.
again, if you're uninsured, we got 2 folks right here, but they're not the only 2 folks. But
Right.
if you're uninsured, call an agent. Don't be afraid to ask
Absolutely.
questions. It's not going to cost you money. I think
Right.
there's a lot
It's
of
no
folks out
obligation.
there
No.
that are afraid it's going to cost them money to deal with
You can come in and sit down with an agent and just see what your options are. It's no cost to you. It's just sit down and figure out what your options are. I mean,
And it
that's
gives you
what
the
we're here
peace of
for.
mind. There's nothing like a peace of mind.
Face to face,
Again,
you can't beat face to face.
There's really no need to rush, although everybody seems to be doing
Right.
it. I think it's as much a curiosity as it is
Exactly.
anything
The
else.
exchange, like everyone's seen on the news, it's having some glitches, it's having some issues. People getting logged in and being able to use it. They're working those out.
And that's affecting y'all.
We can't
as
even
well.
get in, yeah.
Yeah.
Right.
So
It's not like you have a separate special
that's right. We're
password.
same exchange. So we are, the whole word is just be patient. You've got till December 15th to get enrolled for January 1. You don't have to have anything, no penalties will be charged if you can get it done by end of March. So you've got time. Give them a little while to get it worked out. Be patient. Things work out, and you'll get enrolled. So.
And coverage will not begin. If you enroll October or November, your coverage still does not begin until January 1. Is that
Correct.
correct?
That's right. Yep.
That's
That's
Okay.
when it all kicks off. Yep.
And the premium will not be due until the first of January.
When
That's
So
you're
right.
don't think you
actually
can sign up
covered.
today and you can go to the doctor tomorrow.
Right.
Right. No,
Yeah,
no,
this
no,
is
no.
open enrollment for January 1.
January
Yeah.
1. So again, good information to have there. Again, this is a requirement. People,
Yeah.
the hyperbole that's out there, the politics is out there. You have to have insurance.
Right.
You just have to have it now. It's like paying
It's not an
taxes.
option.
You have to have insurance.
It's real. You got to do it.
Yeah.
And it's here. It's here.
It's here. It's here.
It's here.
Again, what's y'all's number? If somebody has questions.
Our number, the main office number in Nash County, in Nashville, is 252-459-3181. I'm Michael Strickland. This is Tanja Fieldback. Ask for either one of us. There's other agents in the office that can help you as well.
Very good. Well, here we go.
There we go. Again, like Sandra said, she'll be on the morning show. She's going to have a long night and an early morning. Call in, ask your questions, and we'll be sure to share it with them. And I'm sure it'll be an interesting discussion tomorrow morning.
What kind of feedback are you getting from?
It's early.
People.
Obviously, not being able to get into the exchange is a little frustrating right now for
Okay.
people.
A lot of questions that's not answered just yet.
Right.
Yeah.
Everybody's just curious to find out what's going to happen.
Right.
So that's, just have some patience. It's all going to get resolved. We're all going to figure out how it
We're
impacts
all
you
in this
individually.
together.
Yeah.
Well, and again, I think you've covered this a little bit, but some people are going to be shocked by the sticker price.
Absolutely.
But
I
there
was
are
shocked.
subsidies. There are subsidies for some folks.
Yes.
Not everybody.
Not everybody.
Not everybody's going to qualify, but
Right.
there are some helpful opportunities out
Some
there.
relief.
If
And again, that's a good reason to talk to somebody
Right.
to find
If-
out what those are.
if you're going to if you're receiving a subsidy, you're probably not going to be too upset about it.
Right.
Okay. But if you don't qualify for a subsidy, you're probably not going to be too pleased with the rates through the exchange. So that's just the bottom line. how it
And there
is.
will be some confusion. You know, my wife works at an employer who won't cover a spouse if the spouse has coverage elsewhere. You know, it's one of those optional carry type things.
Right.
You know, that's going to create some confusion. People are going to have questions. If you can now be covered elsewhere, and that includes the exchange, is that the same thing? You know, people don't
If
know
they
yet.
if they have an option to get on an employer plan, you know, there's no subsidy
There's no
there.
subsidy. So
Right.
there's going to be some frustration out
There is
there.
frustration, yeah.
And the government doesn't have all the answers yet. Just because they open the doors to this, they don't have all the
Right.
answers.
Yeah, they're kind of figuring it out as they go,
Yeah.
working through it, you know.
What do they say? We'll have to know it after they pass it.
We'll read it after they pass it.
There
That's
you
the
go.
way the feeling has been for a while.
And they're still reading it. Because things are coming up daily.
And we have had to bite our
Daily.
tongue to be a
How many
little
pages was it? Like
kind tonight.
250,000
yeah.
pages?
I think that's one of the most famous quotes ever. Let's pass it and then.
before we know what's in it, we have to pass it. So.
Wow.
But it's here.
And again, you know,
It's here.
frustration is out there, political or not. People realize they're going to pay more. Some people may get more, some people may get less. I think in North Carolina, our viewership, for the most part, they're going to see some pain,
Yep.
and it's going to impact bottom lines.
Yeah.
And there may be other things that would be what we would call, expendable income that become affected by this, and whether that's other insurance products that they might carry, or whether
Right.
it's that jet ski you wanted next year.
That's right.
It's going to impact
Eating
the
out
economy
less, yeah.
to some degree. We don't know how
Yeah.
yet, but it's going to
Right.
impact folks.
And I want to also mention the whole mandate on the large businesses, large corporations, of course, was pushed off until 2015. So that we got another year before most of your employers are going to be having to do something, even though folks have already started to make changes now.
Right.
And then the small business, their exchange will open up in November.
In November.
And just to clarify, and this is one of those nitpicks for me, according to the census, federal government, the census, a small business is any business with 500 or fewer employees. According to the Affordable Health Care Act, if you have 50 or more employees, you're considered a small business
Right,
that must
right.
carry.
Right. Yep.
So,
But,
now, if you have less than 50, you're not affected by this at all. But then, if you're an employee of a company that has less than 50, you may have to look at going to exchange if they don't offer coverage.
Right. And a
Some
lot of
do.
companies that have less than 50 employees already offer coverage
Right.
to folks, and that's who will be able to go through the exchange when it opens up in November, the what they call the SHOP program,
SHOP
for the
program.
small business.
And the ones that are probably most at risk if they're 10 and under. Most companies
Yeah.
that have over 10 tend to look at offering some sort of healthcare benefit as part of being in business. It's
Right.
competitive.
Right.
But if you have 10 or less, it's kind of more, it becomes prohibitive sometimes to carry that much coverage.
And let me touch real quick, if we have time, on the corporation side, the employer side. If you have insurance through an employer, okay, we mentioned you would not be eligible for a subsidy. Now, if your employer is charging you 9.5% of your income or higher, then that makes you eligible to go into the exchange and qualify for a possible subsidy. So that's kind of the loophole
Repeat
there.
that again.
Yeah,
because I
so
don't think many people know that.
Yeah.
that's the magic
9.5%.
number, 9.5% and higher. That is folks that will be able to get into waive off their employer coverage and go into the exchange.
Now, will the employer face a penalty because of that?
The first couple of years, no.
Okay.
There's one large I won't mention the name, but there's one large corporation, well known. That's what they're doing. They've increased the rate on the employees to 9.5% of their salary, no matter what you make. That gives them the option to go off,
Because
get
now
in the
it's considered
exchange.
unaffordable.
They can go to exchange,
So-
get the government to pay for it, or go to their spouse's
So
plan.
by
Right.
an active attrition, they're kind of pushing people towards
That's
that.
right.
Pushing them off, saving themselves some money. Now, I think it's about 5 years they can
So
get
they're not
get away
dropping
with
it,
that.
they're just making it.
That unaffordable.
Right.
Increase, and that's their loophole.
Right.
And then I think after about 5 years, if I'm not mistaken, then what they call the Cadillac tax kicks in on those corporations, and
Right.
that's probably when you'll see them bring back the.
And
the
again, on
coverages.
the definition of must carry for the employers who have to have coverage for their employees, 50 or more employees.
Yeah.
It's 32 hours or more per week.
Right.
So if you work 31.5 hours, you don't have to
You're
be covered.
part-time. So,
Right.
yeah.
Okay, we gotta go.
Wow.
Thank you
All right.
for watching, and thank you, Michael. Thank you, Tanja.
Thanks for having us.
Thank you for having us. We've enjoyed it.
Some wonderful information you've imparted tonight.
Thank you.
And we will talk more on the morning show in the morning. Get your questions together. Call their office, 459-3181.
That's it.
Okay.
That is us.
All right. Good night, everybody.
Good night.